morning. I'm energized. How about you? Wow. Okay, we'll get started. For the second year, we are pleased to celebrate excellence achieved in critical care units across the country. 2 years ago, the United States Department of Health and Human Services and the Critical Care Societies Collaborative developed a new national awards program, the first of which were presented on the NTI stage last year. ACN belongs to the Collaborative, which includes 3 other societies whose leaders are with us today. ACCP, the American College of Chest Physicians, ATS, the American Thoracic Society, and SCCM, the Society of Critical Care Medicine. These awards shine a spotlight on one of ACN's most cherished values, true collaboration. They recognize excellence and notable sustained achievement in eliminating healthcare-associated infections in critical care, specifically ventilator-associated pneumonia and bloodstream infections associated with central line intravenous lines. Many of you were part of the teams that submitted more than 200 applications we received this year. Today, the Department of Health and Human Services and Critical Care Societies Collaborative proudly announced this year's recipients. To tell us more about the awardees and the importance of the awards for our country's healthcare, I'm honored to introduce Deputy Assistant Secretary for Health and Healthcare Quality from the Department of Health and Human Services, Dr. Dawn Wright.
Thank you, Wanda, for that very kind introduction. I am so pleased to be here again for the second year of this strong collaboration between the U.S. Department of Health and Human Services and the Critical Care Societies Collaborative. As Wanda said, these awards recognize our colleagues who successfully reduced or prevented healthcare-associated infections for 25 months or longer. Perhaps more importantly, they also showed national leadership in sharing their evidence-based initiatives to improve patient care nationwide. When we presented the first awards at last year's conference, I spoke about qualities of leadership, such as initiative, teamsmanship, flexibility, and judgment. Leaders require other qualities that are vital for us to sustain the advances we've made in combating HAIs. Today's HAI award winners have those qualities. First of all, they have clear vision. After a sentinel CLABSIA death in 2005, one regional center comprising 3 ICUs took careful stock, modified its structures, and implemented system improvements. Despite those changes, the team was unable to sustain 0 CLABSIA rates until it clearly recognized a culture of silence and worked to replace it with one of skilled communication and collaboration. Today's award winners also planned strategically. Another winning team, a 20-bed medical ICU within a 70-bed teaching hospital, began to combat ventilator-associated pneumonia in 2001 with sedation management and practices to reduce the risk of aspiration. One by one, staff change agents learned evidence-based practices and transferred their knowledges to nurses, physicians, respiratory therapists, physical therapists, pharmacists, dietitians, and social workers. As they identified special needs over time, they instituted evidence-based practices in oral care, environmental cleaning, and other measures. This particular team reduced VAP to 0.19 cases for every 1,000 ventilator days for the past 25 months. They've also shown how careful planning and maximal use of limited resources can exponentially expand accomplishments. Our HAI award winners perform ongoing analysis to evaluate progress. For example, one surgical ICU used aggressive and novel multidisciplinary evidence-based strategies to reduce ventilator-associated pneumonia. Cases per 1,000 patients declined from 19 in 2003 to fewer than 2 in 2009. In part, this was due to monthly tracking of ventilator days and ventilator rates using statistical process control charts. Above all, our HAI awardees partner with other stakeholders, like the winning teams, that not only encourage staff in educational, coaching, and mentoring activities, but also partnered with the employee unions, professional organizations, nonprofit groups, state and national governments, and other groups, including the Joint Commission, the Commonwealth Fund, and other thought leaders. Certainly, these aren't the only examples of vision, planning, evaluation, and partnership among our winning teams. In fact, all of our award winners and those that receive honorable mention displayed characteristics that are essential to sustain progress. I don't need to tell you that we live and work in what an old Chinese proverb called interesting times. Our economic and social challenges are unprecedented. Yet even in these interesting times, we're seeing striking reductions in CLABSI rates across the nation, down 33% since 2008. And we're also seeing smaller but solid reductions in other healthcare-associated infections, along with better adherence to prevention protocols. I'm confident that if the success of our award-winning team spreads to all of our critical care units, by the end of 2013, we'll meet our ambitious goal of reducing CLABSI and preventable cases of VAP by 50%. Perhaps more than ever before, it's incumbent upon all of us to work smart, widely applying what we know to work, learning from our successes and failures, and revising and widely disseminating best practices to expand and, perhaps more importantly, to sustain our accomplishments. These are the hallmarks of every journey to sustainability, and they are the attributes of the winning team that we honor here today. At this time, I ask the following 2012 HHS CCSC awardee winners to step forward as your names are called. The neonatal ICU at Doctors Medical Center in Modesto, California for CLABSI. The surgical ICU 4 East at Shands at the University of Florida in Gainesville for CLABSI. Beth Israel Medical Center in New York City for CLABSI. The MICU's SICU Neurocritical Care on the Cusp teams at Mother Frances Hospital Regional Health Care Center in Tyler, Texas. Henry Ford Hospital in Detroit for CLABSI. The ICU at Twin Cities Community Hospital in Templeton, California. They received 2 awards, one for VAP and one for CLABSI. The surgical ICU at Roper Hospital in Charleston, South Carolina for VAP. The MCCU at Tennessee Valley Health Systems, Department of Veterans Affairs, Nashville, Tennessee for VAP. The medical ICU at the University of Iowa Hospitals and Clinics for VAP. The surgical ICU at University of Texas MD Anderson Cancer Center for Houston for VAP. The surgical ICU and trauma burn ICU at the University of Michigan Health System in Ann Arbor for VAP. And Centara Williamsburg Regional Medical Center in Virginia for VAP. Congratulations to you all. Let me say this year we also gave honorable mention to 12 teams for their strong showing. Let's give those teams a round of applause as well. In closing, and on a very personal note, as a fellow clinician, I'm deeply honored to be able to celebrate your accomplishment. Last year at this conference, Mary announced "Together, Stronger, Bolder" is AACN's new theme. It is so clear from the leadership and success of this year's HAI Award winners that you took those words to heart. Your talents and tenacity are what sustain us all. I applaud you. Thank you.